Hey listeners, this is Kelsey and Nate here from the Emergency Medical Minute, and we are excited to tell you about our next big event, Untamed, an event about medicine and wilderness as medicine.
Picture this. You are canyoneering in the San Rafael Desert, the most remote desert in the United States, and suffer an unfortunate fall that leaves your right hand pinned by a boulder. Posed by the threat of death by dehydration, you have to choose between your life or your limb. Our keynote speaker, Aaron Ralston, portrayed by the film 127 Hours, was in this exact position. Guests will hear Aaron's story, along with other inspiring tales of survival.
Guests will also hear from a panel of medical experts on how to survive the wilderness and embrace it as a form of medicine. Tickets and event information are available on our Facebook page and website, emergencymedicalminute.com.
I'm going to talk about pancreatitis and a scoring system that has come into play for determining mortality. You know, pancreatitis in the United States, two most common reasons for it are alcohol, and number two, gallstones or gallbladder disease, but most commonly impacted stone. Now, that interestingly, that's different in the great kingdom of England, where I brought the scones. It's the opposite. Gallbladder disease is first and alcohol is second. But we see a lot of people with pancreatitis. The three diagnostic criteria are you have to have two of these three. You have to have positive imaging, you have to have elevated lipase, and you have to have epigastric tenderness. So if you have two of the three, then you can make that diagnosis. Most of the patients are really just pain management and keeping them NPO. We keep them NPO because anything you put in their stomach is going to trigger the pancreas to release amylase and lipase and increase pain. A lot of patients we can send home. Some patients who we can't control their pain or vomiting, we have to admit. But even though the patients we send home, there's a risk for death. There is a mortality up to 30% in some studies for pancreatitis. So it used to be that we used a scoring system called the Ranson criteria to determine mortality risk and say, is this, patient's pain controlled, they're not vomiting, but can I send them home safely? Unfortunately, the Ranson criteria also requires some evaluation 48 hours into their hospitalization. So it kind of obviates the need for it in the ER. So there's a gastroenterologist out of Brigham and Women's Hospital in Boston who developed what's called the BISAP criteria. And that's something we can use in the ER. BISAP is a mnemonic for BMP, B, I, impaired mental status, S, SIRS criteria, A is age, and P is pleural effusion. If you have none of those, if your BNP is less than 25, if you don't have impaired mental status, and that includes lethargy, if you don't have the SIRS, at least two SIRS criteria, and we're all familiar with that, if your age is less than 60 and you don't have pleural effusion, your risk for mortality is less than 1%. So those are all things that we can consider using when we're looking at our pancreatitic patients who otherwise look well enough to go home. We still have to consider those risk factors. If they have now, the scoring system was not clear as to what number is how high, but I think if you see all those zero, then you can consider patients safe to go home. The end.